Hello, Center Stagers. I have a listener question that I think many of you will benefit from hearing my answer. It says, "Hi, Doc. Do you have thoughts about statins? I have been prescribed them for cholesterol, but I have concerns about being on them. Can you help me understand, and can you reassure me that this is in my best interest?" Great question. A statin is a medication used to lower cholesterol, specifically LDL. It is a medication that blocks or inhibits HMG-CoA reductase. Anything that ends in ASE is an enzyme that helps to break down a certain product to get another end product. In this case, if we have the enzyme, it breaks down HMG-CoA, and the end product way downstream is the production of cholesterol. So in your head, you have to ask, if I block this process, I'm not getting cholesterol. So that means I must not need cholesterol. I beg to differ. We do need cholesterol. Cholesterol makes up our cell membranes. Cholesterol helps our immune system. Cholesterol is needed for vitamin D production. Cholesterol is needed for sex hormone production. That's just a few of the things that cholesterol is needed for. And so if we are lowering it to substandard levels, what is the result? We also need to consider the fact that, is cholesterol, specifically LDL, the cause of heart attacks? I say no. I say there's other things that are the cause. LDL is way down the list. With that being said, is there a benefit of statins at all? And I would say there are two. One is it could lower our risk of having a blood clot. Good thing, because I think that's the cause of heart attacks. Two, it helps decrease inflammation. A good thing, because I think inflammation is also a part of our heart attack risks, not LDL. But are there other things that we can do that can lower our risk of blood clots and lower our risk of inflammation besides taking a statin? I say yes. So if you guys are interested in learning more about what you can do to lower your risk of having a heart attack, stroke, blood pressure, diabetes being the most common cause of heart attacks,